Story 1. Half asleep at around 6 a.m., I stepped into thin air halfway down the stairs and fell about 6 feet, landing directly on my right ankle. The emergency room doctor, the only available physician in town, said, "You've probably only sprained it. You need to walk on it to get it to heal." After a visual inspection from 6 feet away, he did not touch it or bend down to examine it more closely and refused to call the X-ray technician for something he considered minor. I had to wait until the next morning to get one of my staff to drive me to the neighboring town, an hour away, to see another doctor who immediately ordered an X-ray. It revealed my broken ankle and torn ligaments. I was off that foot for about 4 months. My intellectually disabled sister had frequent vomiting, fever, and her skin turned yellow. The emergency room doctor said it was a stomach bug. I insisted on further examination because her skin had turned yellow. In response, he sent her for an ultrasound to calm me and to avoid further questioning. The ultrasound technician reviewed the images, then called his supervisor, who also examined the results. The supervisor asked, "Are you in any pain?" My sister replied, "A little bit." And the supervisor said, "You should be in absolute agony." They found massive gallstones and an infection, leading to immediate emergency surgery. I never saw that first doctor again. Story 2. No, I am not going to redo your Papa Nicolau test. It is not unusual to have an abnormal result once in a while. Come back in 6 months, and if it is still abnormal, we will investigate further. I did not like that and got a second opinion. The diagnosis was endometrial cancer with an additional ovarian tumor. The ovarian tumor could have metastasized quickly if I had not had surgery promptly. Thankfully, everything was caught in time, and I did not need chemotherapy or radiation. However, I cannot help but think of the people who trusted this doctor's word and received a different diagnosis. Story 3. Over the course of 20 years, my pain was dismissed as menstrual cramps. The last doctor told me he would send me to a psychiatrist if I came back because he did not believe my pain was real. By the time they found the issue, I had an ovarian mass the size of my head in my abdomen and pelvis. It had already developed into cancer. Had any one of the dozens of doctors I visited during those 20 years performed a simple ultrasound, this would have been detected before it became cancer. I am currently cancer-free. Besides the mass, I underwent a complete hysterectomy. They removed 19 pounds of tissue from me. Story 4. 7 weeks of bleeding is normal. Our first availability is in another 7 weeks. Come back then. He also rolled his eyes at me and sighed with annoyed exasperation, the same way a moody teenager does. I had been bleeding for more than 7 weeks already. As this provider told me the above statement, blood started gushing down my legs. It was summer, and I was wearing white shorts so he could clearly see blood pooling down my legs. I waddled off to the closest bathroom, cleaned myself up, and called my primary care doctor to explain the circumstances. My primary care doctor usually does not handle gynecologic issues, but he was stunned into silence when I explained what had just happened at my usual gynecology clinic. He responded, "I have a friend on duty at the emergency room at the hospital across town. I will contact him directly and let him know you are on your way." I grabbed an extra roll of toilet paper to cover my driver's seat so I would not bleed on it, and drove myself to that hospital. That hospital had me in an operating room barely an hour later. Story 5. When my brother was born, he was unable to swallow. He was in the neonatal intensive care unit. They had him on a feeding tube and were suctioning him regularly to keep him from aspirating. On Mother's Day, my mom asked the head of the neonatal intensive care unit what his odds were of surviving, and without even looking at her, he said, "Your son cannot swallow. People who cannot swallow eventually choke on their secretions and die." Then he walked away. My brother just turned 40. Forget that doctor. Story 6. A doctor told me a particular problem I was having was because of my weight. I said, "It has been there when I was underweight, overweight, and everything in between. If you can tell me the exact number on the scale where it will not be a problem, I will try my best to get there." I lost weight again, but it was still a problem. He is not my doctor anymore. Story 7. When I told my pediatric psychologist that I was seeing things I was pretty sure were not real, she told me, well, some people are just more attuned to the other side. When I moved, I finally got a new psychologist who recognized that I was having manic episodes with hallucinations and put me on a mood stabilizer. Story 8. I was having dizzy spells so bad that I couldn't stand without vomiting or falling down. One day, I woke up and couldn't walk in a straight line. I saw an ear, nose, and throat specialist and had a magnetic resonance imaging scan on my ear. It turned out I had a physical anomaly in my ear. I am missing a bone or some tissue that would normally separate a main artery from my inner ear. As I age and tissues sag, the artery pushes directly against my inner ear, causing tinnitus and making me dizzy. While explaining the results of my magnetic resonance imaging scan, the specialist said, "And guess what we can do to treat it?" With excitement, dumbfounded, I stammered before he exclaimed, "Nothing!" I literally just started sobbing. I was 28 and suddenly couldn't walk. This man was laughing at my diagnosis. Story 9. My gynecologist looked at my chart and said, "Oh, you are 32? Better hurry up and have children before your eggs lose viability." I switched doctors that same day. Story 10. A doctor once told my friend, "It is all in your head," when she was actually dealing with a real autoimmune disease. She felt very dismissed. Story 11. A psychiatrist once told me my depression would go away if I just smiled more and wore prettier clothes. I was literally there because I could not get out of bed for weeks. It still makes my blood boil thinking about it. Story 12. A friend was having a miscarriage after waiting a long time to have children. The fetus had lost its heartbeat, and her body was already starting to pass it. To speed the process and reduce her suffering, she was prescribed medication to complete the miscarriage. When she went to pick up the prescription, the pharmacist, who should understand all aspects of the medication, shamed her harshly. The pharmacist asked, "Do you really want this medication? Do you know what this does? Are you sure you can live with this?" She was trying hard not to cry and simply said yes, but she looked very broken later that day when I saw her. Story 13. I am a paramedic. We frequently have students, often young with little life experience. We responded to a mental health call. The student did very well, having a heartfelt conversation with the patient who had attempted and failed to hang themselves. We put a lot of support in place. The patient was receptive and willing to engage with mental health support teams alongside us. As we were leaving, the student patted the patient on the back and said, "Just hang in there." The patient immediately had a breakdown, and we had to start again. Story 14. Doctor, I'm not having periods anymore and I'm having hot flashes. You women are always imagining health problems. Are you really trying to say you're experiencing menopause in your 30s? I'm so embarrassed for you that I'm not even going to put it in your chart. A year later, I finally saw an endocrinologist. When he looked at my blood work, he was shocked. I was postmenopausal. Why didn't you tell anyone? Took a few years, but it turned out to be a flare of psoriatic arthritis that destroyed my ovaries. Story 15. I am an actor. I was extremely depressed and stressed when I began therapy. The therapist knew nothing about my profession and just said, "Why don't you act like you were feeling better?" Pretending I was fine when I was not, and when my circumstances were not better, was actually part of the issue. Story 16. I went to see a specialist about my endometriosis, diagnosed via laparoscopy, because I was experiencing some worrying symptoms. My magnetic resonance imaging scan came back normal, which is common for endometriosis not to be visible on the scan. He told me I should consider myself lucky that I did not have something like cancer and that he did not want to refer me until I was in real pain. It turns out my deep infiltrating endometriosis, which was left untreated, has now caused adenomyosis and spread to my bladder and bowel. I wish I had made a complaint at the time. Story 17. My friend's girlfriend, who was 18 years old and whose parents were from Vietnam, went to the gynecologist for a checkup. During the examination, the doctor casually said, "I thought Asian girls always had small breasts." Story 18. I have vaginismus. When I first discovered it about 15 years ago, I set out to find a solution. It's supposed to hurt when women have sex. Have you tried having a glass or two of wine before sex? A hot bath should help you relax. I was told this by multiple female doctors over the years. Not surprisingly, none of their suggestions worked. I finally gave in and went to a male obstetrician gynecologist. I did not have high hopes that he would understand. He listened to my symptoms, did an exam and said, "That is definitely not what this should be like. Let me get you set up for physical therapy." He is still the doctor I go to because of this. Story 19. Not a doctor, but my dad's girlfriend works in the office. I had been sick for a week and couldn't even walk up the stairs in my own house. I went to the nurse's office at school and got paperwork to go to the clinic. I showed my dad and asked him to sign it. That's when he finally made an appointment for me. He couldn't go because of work, so his girlfriend took me. She told the doctor I wasn't sick and probably just needed to lose weight. The doctor said, "No, it's pneumonia." I was out of school for a week after that. Story 20. The doctor really wanted my symptoms to be fake because that was the conclusion he had already drawn, and he was very upset when a few things in my tests turned out to be slightly elevated, so he could not deny me care. He gave a big frustrated sigh and said, "Look, your levels are slightly elevated, so I'm going to admit you." But then he trailed off because I think he realized he would get in trouble for what he planned to say next. It is good he did because it turns out I was completely right, and we caught something that could have been very dangerous very early. Story 21. Someone I know was explaining that she has an iron deficiency but is afraid to watch her diet too strictly to manage this deficiency because it could cause her to relapse into anorexia, for which she has had hospitalizations in the past, especially at a time when she is very stressed due to a new job and a breakup. The doctor looked her up and down and said, "Oh, it's okay. You don't seem to be at risk of anorexia." Not only is this a careless remark given the situation, but she is just at her ideal weight and must be a size 8 in US sizing. I cannot imagine what it must be like for people with eating disorders who are overweight. Story 22. I was in the emergency room after months of unknown stomach pain. The doctor told me it was probably just a virus and that teenage girls tend to exaggerate their pain. A few months later, I needed emergency gallbladder surgery, which fixed the issue. Story 23. I had severe driving anxiety after an accident. The therapist I saw wanted me to go to Philadelphia, but when I told them I couldn't because of my anxiety, they said, "Can't you just close your eyes?" Story 24. I went to get a doctor's note. I had pneumonia and could barely stand. The doctor told me I did not look sick and was faking it. It took me almost collapsing for him to believe there was an issue. Story 25. As every overweight person can tell you, most doctors will say that every issue you have can be fixed by just losing weight. This is almost always explained in a condescending way. Can't sleep, tired all day, depressed, just lose weight instead. Joints hurt, making walking hard, just suffer through the pain and lose weight. I have gone to the doctor with concerns only related to maintaining a current medication, and they still preach about weight half the time. Story 26. My general practitioner told me that it was normal for my heart rate to regularly reach 187 beats per minute when getting in and out of the shower or walking up the stairs. I asked for a change in medications that would help my heart rate for my health condition, but instead of assisting me, they referred me to another doctor. The new doctor saw my heart rate ranges and readings and was shocked that my general practitioner said it was normal. Story 27. A medical colleague snapped at a young girl with anorexia because she was reluctant to tell them her weight. Story 28. Migraines are real. I had a severe one lasting 3 days, during which I could not tolerate lights or sound. I found a new doctor. Story 29. Trigger warning. Death. When I was young, my brother got really sick. He was 5 at the time. My mom took him to our pediatrician in a stroller because he didn't even have the strength to stand on his own. This is important for later. The doctor told my mom to just give him acetaminophen, and he should be fine. Later that night, he died. There was a police investigation. They went to our pediatrician and asked how he was when she saw him. She told them that he was fine, even running around the office playing with the toys they had, which was a blatant lie. I thought that was really wrong because then the police started trying to blame my parents for his death. He was later found out he died of salmonella. Story 30. Me. Why are you depressed? You have a good life. Like, yes, I know, but my brain still isn't functioning properly, which is why I am depressed. A friend. He is like 6 feet tall, muscular, and his 5 foot petite girlfriend attacked him. He went to a doctor because he wanted evidence saved in his file as he planned to report her. The doctor said not to because he is a big man and she was just a tiny woman. It didn't really count as domestic violence. Story 31. I drove a friend to the local medical center because she needed to see a doctor. I do not know why, as it was none of my business. I waited for her in the waiting area while she saw the doctor. Afterwards, she returned in tears. Once we were back in my car, I asked if there was anything I could do to help. She told me that the doctor had lectured her about her lewd lifestyle and said she should clean up her act. Whatever was ailing her, the doctor believed her supposed loose lifestyle was the cause. However, she did not live that way. She was not seeing anyone, was not a party girl, and spent all her time studying and working. I did not see how turning to Jesus would have helped, especially since she was a Hindu. I looked up the doctor and saw that other patients had left negative reviews online for similar comments. Thankfully, the medical center changed ownership, but I had no reason to ever return there. Story 32. A doctor told my significant other that the pain he was feeling was all in his head. He died later from liver failure. He did not drink. Story 33. Had an ex who went to a male gynecologist. During the pelvic exam, she stated that it was causing her some discomfort because of the size of his fingers. He told her, "You have had a child. It shouldn't hurt you like that." While continuing the exam, she changed doctors. Story 34. I was newly married and went to the doctor to get back on antidepressants I had been on in the past. I have had severe anxiety and depression my whole life, but I had to stop my medication when I lost insurance. After getting married, I obtained insurance again. The doctor wanted to try me on new medication, but I told her I just wanted to be on my old ones. She said, "Since you are newly married, you might want to try something new and stronger, as depression and anxiety often cause problems in marriages. You wouldn't want to ruin your new marriage, would you?" I never went back to that doctor again. Story 35. First, we'll cure your cancer, then we'll send you to rehabilitation, while he wrote a script for an excessive amount of opioids. Subsequently, I was cured of cancer but also became an addict, both because of him. Clean for less than 12 years, not thanks to him. Story 36. So much medical gaslighting has affected me and my family. My sister was told her stage for endometriosis was just constipation and to eat some raisins. By the time they did surgery, after she couldn't conceive, her bowel and ovary were fused together. She was told she was just overweight and needed a diet when she actually had multiple sclerosis. She was finally diagnosed about 2 months after being told this. She used to be an athlete and held national titles. The woman was not overweight by choice. Her husband was sent home from the hospital with a ruptured spleen and almost died from it. My other sister was told her gallstone pain was just in her head when she actually needed her gallbladder removed. I walked with crutches during and after my last pregnancy for 2 years, about 10 to 12 years ago. By the end, my general practitioner told me I just needed to go back to work. I have just found out a couple of weeks ago, after struggling again, that my hips are deformed and have been since adolescence. I was also told for the last 2 years that my burning red face, which comes with nausea, feeling cold all over, and extreme tiredness, was rosacea. It is actually anaphylactic shock occurring several times a day. Story 37. I told my mom that I was anorexic. I was 16 and there for a strep test. I was underweight, yes, but had been my whole life and had a healthy appetite. She told him this after he brought her in from the waiting room to tell her in front of me. He would not drop the anorexia diagnosis, and my strep test ended up turning into bacterial pneumonia. Story 38. My ex and I took our daughter to the doctor when she was not feeling well. The doctor asked us questions about how we cared for her, made judgmental comments about my ex still breastfeeding, and basically shamed her, saying our daughter was too old for it. Our daughter was 7 months old at the time. Story 39. At the end of COVID-19, I called my primary care provider because I had potentially been exposed to hepatitis B from bad pork. I called to get an emergency hepatitis B vaccine. The receptionist pulled up my information and audibly gasped. I asked if everything was okay. She said, "Well, it looks like you haven't had a physical exam in over a year." I replied, "Yeah, COVID-19 kind of threw a wrench into that sort of thing." She said, "We don't give vaccinations to anyone without an updated physical exam." I said, "Okay, that's fair. Can you get me in this week?" She said, "No, the earliest appointment is 2 months from now." I said, "2 months? I understand this is a spur-of-the-moment request, but this is important. Isn't there anything you can do to squeeze me in?" She said in a very accusatory tone, "Maybe if you were more proactive about your health, we wouldn't be in this situation." I was shocked that she said this to me. I was able to get the vaccine literally a day later through the Department of Health. I left the practice the day after that and filed a complaint with the office on my way out. Story 40. My mom was in high school in the 1960s. She kept having her period for 3 weeks at a time, then 1 week off, followed by 3 weeks again, with heavy bleeding most of the time. She talked to her doctor and asked if that could be why she was fainting regularly. He told her it was normal and did not think to give her iron pills. My mom also walked around on crutches with a fully torn ligament in her ankle for a year because no one took her pain seriously. She finally found a doctor who performed surgery and fixed the ligament. Story 41. Well, I was too shocked to recall his exact words, but it started with, "And my Lord Jesus will be returning soon." I stopped listening at that point and, of course, never went back to that doctor. I am not okay being treated by someone who looks forward to the end of the world. Second, when I complained about the pain, he said, "Well, that's just your subjective experience." It is shocking that such a comment would have to take second place. Story 42. I was once told to have sex anyway, even if I did not want to, when I requested she not prescribe me Prozac and asked for Wellbutrin instead. In the initial discussion, I told her I did not want to give up the sexual desire aspect of my life. She shrugged and nonchalantly told me I should just do it anyway if I was worried about making my boyfriend happy. This was, of course, after I disclosed that I had a history of sexual trauma. Some people should not work in healthcare. Story 43. Why do I have a feeling this is going to be all women who reply? I am not saying it cannot and does not happen to men, but women's pain is not taken as seriously. This has been and is currently being studied. Story 44. When I was diagnosed with multiple sclerosis, the diagnosing neurologist said, "Well, just be glad it is not diabetes." Within 3 months of diagnosis, I had lost the use of my hands, could not walk, and slowly lost my vision. The physician assistant then said, "Just stop complaining. This is your new normal." On top of this, my father also had multiple sclerosis. He had been wheelchair-bound since I was 7 or 8, without the use of his hands since I was 16, spent the last 20 years of his life bedridden, and died of late-stage multiple sclerosis 6 to 7 months after I received my diagnosis. My original neurologist put me on one of the least effective treatment options because it was important you take a treatment that will not impede your ability to get pregnant and carry a child to term. Despite the fact that I am single and not trying to have a baby. Needless to say, we found a specialist who changed things significantly and started me on steroids and one of the strongest treatment programs. I eventually regained all my abilities and am now in my 14th year of being relapse-free. Story 45. I had a new doctor who was in disbelief to the point of anger that I did not have diabetes. Another compared me to livestock. If we include therapists, it was when I was 12 or 13 and my therapist told me that nobody would ever want me because I was fat. I think that was intended to motivate me to lose weight. Story 46. She argued with me that I had osteopenia when the report clearly stated osteoporosis. I am assuming she never even looked at it. I just wanted to know if I should take a supplement. Story 47. In my mid-20s, newly divorced and thinking about dating again, I went to a women's clinic to get a prescription for the birth control pill. I was about 30 pounds overweight. The doctor looked at me and told me I shouldn't go on the pill because of my hypertension. I told her it was amazing that she knew my blood pressure without taking it. She sighed and put on the blood pressure cuff. Then she had a shocked look when she told me it was 96/60. I told her yes, that's what it always is. I really hope she learned something that day, but I doubt it. Story 48. Probably when I blew out my shoulder in the army. I told the doctor that I likely had a concussion. He walked off and came back with a syringe. Out of curiosity, I asked what he had in it. His response still blows me away. Doctor, it's like ibuprofen, just a lot stronger. Me. So it's a non-steroidal anti-inflammatory drug? Doctor, yes. Me, so it's gonna thin my blood. Doctor, yes. Me, I am quite certain I have a concussion. Doctor, so? Me, extreme brain bleeding is not a good thing to have right now. Doctor, what? Oh. He then capped the needle and put it away. For reference, I am in aviation, not medical. Pass, just hard pass. Story 49. Not a huge issue like others, but it was dismissed as most women's concerns are. I was exhausted, kept getting sick with colds and flu, and just didn't feel right. I was told, I don't think there is anything wrong except that you are a mother and mothers are always tired. I pushed for blood work and found out I was vitamin D deficient and anemic, so I needed an iron infusion. I had a history of poor iron levels, but apparently I was just tired. Story 50. My very first therapist got mad that I wouldn't talk about my issues within the first 2 sessions. I was nervous and needed time. She told me not to come back. I tried to take my own life shortly after. I did not succeed but received medication and found a better therapist. Now I am a therapist, and I give people all the time they need to feel comfortable before discussing difficult topics. Story 51. A doctor told my wife that her knee was severely injured. She asked him if he could explain it in simple terms. Story 52. In early labor with a breech baby that was almost 9 pounds, I bent over on the operating table for an epidural. I could feel the needle scraping against bone. The anesthesiologist said, "This is so much harder to do on overweight women." More recently, I had surgery on my thumb for trigger finger. This was a fully anesthetized surgery, not a local or nerve block. This was the surgeon's process. The anesthesiologist came in before surgery to discuss the medications. He was very dismissive and rude. He told me he had this procedure and it was just an office visit with a local anesthetic. When my surgeon came to check in right before surgery, I told her that I would not allow that anesthesiologist to work on me and asked for someone else. He was not supportive of the surgery, and I did not feel he would be attentive. At first, she looked at me like I was unreasonable. Then her expression changed, revealing the male arrogance. Story 53. I'm not giving you drugs. When I have zero history of drug seeking, I asked for more tests because I knew something was wrong with me. I finally went to a new doctor. It turns out I had cancer and a couple of different autoimmune diseases on top of it. That doctor was very rude and made me feel insignificant. It's tough being young and having real issues, especially as a woman. Story 54. I had a horrible labial abscess a few years ago and went to urgent care. The doctor called the gynecology office to have one of their doctors come take care of it, but they didn't call him back. I kid you not, the urgent care doctor looked me straight in the eye and said, "Well, I don't know what I'm doing, but I'm doing it anyway," and proceeded to butterfly my right labia lip and insert a balloon drain with only local anesthetic that didn't work. It was an abscess that needed to be lanced and drained. I ended up in the emergency room 2 days later, screaming in pain because every time I moved, the incision where the drain was would open. The emergency room doctor was a woman and kept saying that men should never deal with women's health issues, especially when it comes to something like this. She removed the drain and treated the abscess properly. I will never forget that experience and have a scar to remind me. Story 55. In high school, I started having urinary incontinence. I wet the bed a couple of times and once wet my pants at school. My mother took me to the doctor, who asked, "So, are you sexually active?" "No." He looked at my mother and scoffed. He asked her to leave the room and again asked, "Okay, she's not here, so you can tell me the truth. Are you sexually active?" Still no. My mother came back in. "I don't care if you think she's Mother Teresa. I'm going to do a pregnancy test. Here's the thing, That was a few months into a couple of years of being sexually abused by a church member. The abuse was likely the reason for the incontinence, a sign that doctors, especially pediatricians, should be aware of. Instead, the doctor essentially accused me of being promiscuous and did nothing about the incontinence, even when the pregnancy test came back negative. Story 56. I was trying to get a referral for a new obstetrician-gynecologist for a hysterectomy after bleeding nearly every day for 2 years. My female primary care provider told me that I did not need one, saying that since I had not had children, my uterus was hungry, and I just needed to drink celery juice instead of coffee. Story 57. I had a miscarriage and had to see a walk-in clinic doctor afterwards. I explained that it was an unplanned pregnancy. Then he told me, God knows when babies are wanted or not. That is why this pregnancy ended in miscarriage. Story 58. A man had just been diagnosed with biliary duct cancer, a highly aggressive cancer. His doctor told his daughter that he had 1 month left to live. She was shocked because he only had yellow skin but felt well. She became overwhelmed, started walking away, and then passed out. Story 59. I had a severe chest infection and needed an arterial blood oxygen test, where the doctor had to draw blood directly from the artery in my wrist. Usually, doctors say things like just a sharp scratch or something similar. He said, "This is really going to hurt." He was not wrong. Story 60. I'll be the first to say we look young, and we started our family younger than most, but we were married over a year before we had our child. As the child's height and weight were being recorded, they asked for the father's name. I gave my name, spelling the last name as usual. The nurse said that if I do that, I am responsible for raising this child for 18 years. I replied, yes, it is my child. She asked if I was sure again. I said yes. She asked if I was really sure. I offered to throw her out a 4th-story window. She wrote my name down. Every time a doctor asks if I'm sure, I flash back to that moment. Story 61. I am a recovering addict. I needed elbow surgery. I spoke with everyone at the surgical center about safety precautions regarding painkillers and created a comprehensive plan for monitored pain management after surgery. When I got home with the discharge papers, there was a prescription for opioids. Thankfully, I am in long-term recovery and not tempted, but it made me very angry for any other potential addicts. Story 62. Many years ago, while I was still married, I found out my husband was having an affair. It was his 3rd. I should have left sooner. This time, he had been having unprotected sex with her for months while he was away at advanced individual training and, when he came home, had unprotected sex with me. After filing for divorce, I went to my doctor and asked for every sexually transmitted infection test available. The first thing the doctor did was start lecturing me about military spouses and how they start cheating as soon as their husbands deploy, and about how faithless and deceitful I was. I burst into tears and said I had found out he had been cheating on me for months with a female soldier in his unit. My doctor's response was, "Oh." Story 63. My grandpa was cutting limbs from a small tree and fell. He could still walk around and seemed physically fine, but he was not making much sense when he talked. We took him to the emergency room, and they diagnosed him with pneumonia. A few hours later, he had to be airlifted to a hospital in Atlanta for emergency brain surgery. He had suffered a stroke. He never came home. Story 64. The doctor told my mother that no one is allergic to any fresh fruits or vegetables. Those allergies do not exist. For myself, an orthopedist told me I never dislocated my shoulder. Story 65. Maybe if you lose some weight, your periods will regulate. I found out I have an extreme case of endometriosis and had to have half of my uterus removed. Women's healthcare is outdated. Story 66. After suffering a mild heart attack in 2009, I asked my attending physician why it happened. He replied, "It was probably due to my sedentary lifestyle." I told him that apparently the 1,500 miles I had ridden my bicycle in the previous 9 months were not enough. To say his jaw dropped would be an understatement. I have had 2 different Veterans Affairs clinic nurses tell me that at age 53 I was too young to be in that much pain. These are the same nurses who deal with 19-year-olds with traumatic amputations. Story 67. I am from Davao City, Philippines, where we have a public hospital that provides completely free medical services, which I truly appreciate. I work as a call center agent, and there was a time when I experienced severe abdominal pain and was later diagnosed with appendicitis. I immediately went to the public hospital for help. After waiting for about an hour, a doctor came to examine me. Once he confirmed that I had appendicitis, his reaction shocked me. He said something like, "For God's sake, there are already too many patients needing surgery, and now you've added yourself. I don't care if you people die." I was stunned and deeply hurt by those words, especially while in so much pain. Feeling neglected and fearing for my health, I decided to transfer to a private hospital despite the cost. I had to endure another hour of travel while in excruciating pain. The taxi driver was even getting nervous. Thankfully, I was admitted that night. The next morning, I received a call from the public hospital staff, telling me that leaving after being checked was against protocol and technically illegal. I was incredibly frustrated because I felt like I had no choice. I was not given proper care, and I was genuinely suffering. This experience left me deeply disappointed and disheartened. While I know there are many hardworking and compassionate healthcare professionals in the Philippines, that particular experience made me feel like the system failed me when I needed help the most. Story 68. They laughed in my face when I requested sterilization. At 37 years old, not that my age should matter, but it makes it a bit more absurd. Story 69. During my studies, I had major problems with depression, dark thoughts, and anxiety. I literally could not go out on the street without having an anxiety attack. Luckily, I was in a kind of boarding school, so my accommodation, classes, and university canteen were all in the same building. I ended up going to see a psychologist with difficulty because it meant going outside my school building. He asked me what I was studying and what my grades were. I told him my school was one of the best in the country in this field, and my grades were still good. His response was, "Oh, if you are taking this course and even managing to get good grades, then everything is going well. Congratulations. You absolutely do not need me." I said, "Thank you. I am also very happy to be solving my math problems, but I was coming to see you because I cannot get out without having a panic attack or wanting to throw myself under the wheels of a car." Story 70. This will probably pale in comparison to many responses here, but its impact on my life was significant. I had been seeing an orthopedist for about a year and a half for a torn meniscus. It was too inflamed for my age, and an MRI showed heavy inflammation not just in the knee but in other unexpected areas. The orthopedist diagnosed me with osteoarthritis and said they wanted to see me again in 6 months. Meanwhile, in significant pain, I suggested that I should maybe see a doctor who specializes in inflammation if this was apparently the main issue. The doctor looked right at me and said, "Yeah, that's us." Okay, I guess that's why orthopedist and rheumatologist are two different specialties. I scheduled an appointment with a rheumatologist and was diagnosed with rheumatoid psoriatic arthritis on day 1. I was prescribed medicine that, at the time, provided unbelievable relief within a week. But the arrogance of a medical professional who knew I had a previous psoriasis diagnosis, pretending like I couldn't read or understand definitions, was pretty disappointing. Story 71. I was told to stop asking questions about my medications because that was overthinking, apparently. It turns out I am prone to paradoxical reaction, and she did not want to hear it. Story 72. I was seeking a mental health referral from my primary care provider because my mother had terminal cancer when I was between 23 and 28 years old, and it was obviously difficult for my mental health. I am overweight. I know this. The doctor, before asking why I came in or looking at anything other than my weight, told me that I am morbidly obese and at risk for many serious complications. I explained that much of the weight gain is related to the intense depression I am experiencing because of my dying mother. He responded, "Well, then exercising can serve a dual purpose." Story 73. We know what is best for you. This was said to me about 15 minutes before the doctor ordered an epidural that did not work because of scar tissue. Thank you for putting me through a cesarean section without anesthesia. Head Doctor of Gynecology and Obstetrics at Wake Medical, 1993. Medicaid and Medicare do not pay me enough to care. Retired, well-liked allergist in Asheville. Story 74. Your wife's cancer is spreading rapidly, and we are out of treatment options. We will be referring you to hospice. She has maybe 2 to 4 months to live. No, it was exactly 4 weeks. Story 75. I have a genetic condition that, among other things, causes my joints to spontaneously dislocate or partially dislocate. This is extremely painful. For me, the first joint this started happening to was my shoulder. It is a very shallow joint, and if the head of the humerus moves out of place enough, it starts to wear down the cartilage and makes it easier for it to slip out again in the future. Before I was diagnosed, I just knew that I had a problematic shoulder that was really painful sometimes. I had seen several doctors about it, and one finally referred me to an orthopedic specialist. I remember being very excited about the appointment because I was finally going to get some answers and stop being in pain all the time. He was an older man, and after listening to my story, he said, "I think you should consider a breast reduction." Story 76. First gynecologist appointment at 17 years old. I was nervous and closed my legs. He said, "I know you know how to spread your legs, so please spread them." Story 77. It is probably not the worst, but I had an obese obstetrician gynecologist, not my specific obstetrician, but one in the rotation I had to see during weekly appointments, tell me I was gaining too much weight and was well on the way to being obese. My ex-husband said, "That's the pot calling the kettle black." The comment was very unprofessional. It was something like, "You're getting too fat. It is not baby weight. It is just weight." Story 78. A psychiatrist, when I was a teenager, pulled my mother into the room and said that he was discontinuing treatment because I was a waste of his time, too weak to survive in this world, and that I would kill myself before age 30. I also went into the emergency room with intense pain rated 10 out of 10. The doctor did nothing, saying it was my gallbladder and that I should lay off the cheeseburgers, and I would be fine. I went back a few days later when the abscess on my intestine had perforated. Story 79. After my dad died, Mom had died 4 years previously, and I was the main caregiver for both of them. My grief counselor pointed out that I was an orphan now and asked how that made me feel. She refused to call me by my preferred name. For example, if my name was Sue Ellen and I wanted to be called Susie, she would only call me Sue, which was not my name. I am a writer, and at our last session she said, "You write strong characters, so you don't have to be strong in real life." By saying this, she implied that I was a coward and a weakling and defined my creativity as a symptom of an illness. For months after that, I considered ending my own life, but I did not want to cause my family any more pain, so I toughed it out. I do not trust counselors now. Story 80. Not me, but a patient of mine. I went to do a kidneys, ureters, and bladder exam on a woman living in an independent living facility. She was in her motorized chair when I arrived at her apartment and got into bed on her own for her exam. She explained how frustrated she was because doctors kept ordering kidneys, ureters, and bladder exams on her when she insisted she was regular and had no issues. She was, however, having pain in her left hip. I listened to her and said we might as well get the exam while I was there. I am so glad I did because she had a severely fractured femur. As soon as I saw the X-ray, it was unmistakable. While I am unable to legally diagnose, I explained there was a reason she was having pain in her hip and advised her to stay in bed and not move while I got help. Reports came back quickly, but I did not want to leave this woman in that condition, so I found someone to assist, and they called an ambulance to take her to the hospital. She was relieved to finally know why she had been hurting and was in tears thanking me. I always advocate for my patients because sometimes they are not listened to as they should be. The ambulance arrived before I even left the parking lot. I am just glad she was able to get the care she needed. Story 81. I was seeing a pain specialist for 2 slip discs that were putting pressure on a nerve, as well as chronic hip pain due to impingement that damaged my labrum. The first thing out of his mouth was, "You have pain because you've had children." I replied, "I do not have children and have never been pregnant." He said, "Oh, you should have a baby then, that could help." I have never been so angry in a doctor's office in my life. I had clearly mechanical physical reasons for the pain, and all he wanted to do was talk about babies. I walked out and reported it, but nothing ever came of my complaint. For your information, doctors, women have bones and nerves that are not connected to the uterus. Story 82. Here is a chart showing how fast people die when their symptoms are similar to yours. This was said to me at 18 years old by a nurse practitioner as a scare tactic. I was doing everything as prescribed, but things were declining anyway because that is how disease progression works. I mentioned it to my respiratory therapist later, and at my next appointment, I received an apology from the pulmonologist. I never had to see that nurse practitioner again. Story 83. When I found out I was a genetic carrier for the cystic fibrosis gene, I received the news after my unborn daughter's tests. I was at 20 weeks when the midwife called me and said, "You have the cystic fibrosis gene. We have to test the father now." I was so distraught that through tears I asked what I should do next. She said, "Don't bother asking about aborting. It's too late anyway." At the same hospital when I was having the baby, I went into precipitous labor and was in extreme pain. My blood pressure shot through the roof, putting me at risk for a seizure. The nurses told me to calm down because I was scaring the other mothers on the ward. When I delivered her and sustained a 4th-degree laceration, the plastic surgeon sewing me up looked at my daughter's father and said, "We added an extra stitch just for you, sir." They did not have my consent. I have a lasting birth injury from everything I went through at that hospital and major post-traumatic stress disorder surrounding medical care in general. Story 84. I spent almost a year waiting to see a specialist for a vascular compression I suspected I had, and it turns out I do have it. I had heard amazing things about this specialist. She was a lifesaver, a saint, warm and kind. I was very excited. Important side note. I have a long list of complex chronic health issues, none of which have official treatments, but I have had a lot of success with off-label treatments for most of them. My husband and I arrived for the appointment and spent 30 to 40 minutes with a pharmacist and a physician assistant who gathered my entire history, which was very promising. The pharmacist left to get the doctor, and the physician assistant stayed. The doctor opened the door, and with her hands still on the door, the first words out of her mouth were, "You do know that there are no treatments for anything you have and nothing anyone can do to help you, right?" "Hi, I'm Dr. So-and-so." My husband, the physician assistant, and I all had our jaws on the floor, staring at her, flabbergasted. I was so shocked I couldn't say anything. She then said I likely had the vascular compression, but that it was not worth investigating. I had been barely eating 500 calories a day for the better part of a year due to the compression and had been dealing with severe constipation that normal gastroenterologists were unable to figure out. My gastroenterologist sent me to her specifically because she did not know how to help me anymore, and this specialist could have ordered a much-needed feeding tube. She also offered to look at a CT scan with abnormal results that no one could explain. She told me I probably had small bowel Crohn's disease, but I was already on a biologic for my autoimmune disease, which would also treat the Crohn's, so it was not worth investigating further. She did not get back to me with any answers on the CT scan. She stopped responding, and there were a number of issues with her office. I tried to switch to another doctor in her office, but that also became its own fiasco. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.